Good morning, everyone. I want to thank everyone for joining us today for our Disability Policy Academy, a capital recap, disability policy in the 87th Legislature, which is being co-hosted by the Texas Council for Developmental Disabilities, that's TCDD, and the Governor's Committee on People with Disabilities, the GCPD. I appreciate you joining us today. I am Scott Daigle, the Public Policy Director for TCDD. And for those of you that don't know, TCDD is established in state and federal law and is governed by 27 governor-appointed members, 60% of whom are individuals with developmental disabilities or family members of individuals with disabilities. The council's purpose in law is to encourage policy change so that people with disabilities have opportunities to be fully included in their communities and to exercise control over their own lives. And you know what? I'll stop sharing my screen right now so that I can continue talking with y'all. So TCDD is committed to informing and engaging self-advocates and stakeholders on issues that impact individuals with intellectual and developmental disabilities. And one of the ways that we do this is through our Disability Policy Academies, which feature presentations from state and national experts on IDD issues. Academies provide policy professionals and stakeholders with an opportunity to take a deep dive on a specific topic related to IDD, to help get an overview of an issue, to discuss what gaps exist, and to determine recommendations for addressing those gaps. We also provide overviews of the process of impacting public policy. Previous academies have covered topics such as employment, residential options, sexual assault, and the school-to-prison pipeline. And our plan is to continue hosting them every few months and to maintain this online format so that people across the state can still attend. So a few quick Zoom housekeeping notes. Attendees will be muted and the chat function should still be available. However, you can also enter questions into the Q&A feature, and we'd appreciate if you enter them into the Q&A feature instead of the chat. And the panel will try and answer them in the final portion of this discussion. This event is being closed captioned, so if you'd like to use it, click on the link below. Also, if you look in the chat, there should be a link if you'd prefer to open up the closed captioning separately on your web browser. You can find a link in the chat for that. Additionally, we have interpreter services throughout the discussion, which if you want to see on your screens, you'll just want to find the interpreter and pin them on your screen. We do have two interpreters that are going to be switching in and out. So if one of them goes out, you'll just want to quickly look for the other interpreter. And the event is also being recorded, and we plan to make the video available early next week. So coming out of the legislative session, TCDD had been planning to do a recap event, and then the Governor's Committee reached out to us and asked if we'd like to partner up on one. So we were so grateful for the invitation and to have them as co-hosts for this Policy Academy. And with that, I'd like to turn it over quickly to Ron Lucey, the Executive Director of the GCPD, who will share information about his organization. And after that, we'll get started with the recap. So Ron?
Thank you, Scott. First, I want to thank you and Beth Stalvey and all the hardworking staff of the Texas Council on Developmental Disabilities for allowing us to partner with you on this wrap-up of the 87th Texas Legislature. You all do a phenomenal job of monitoring the Texas Legislature and keeping Texans with disabilities informed on important legislation that's going to affect their lives. So a little background on the Governor's Committee on People with Disabilities. We're the leading state agency, across disability state agency, for informing the legislature and the governor and executive branch on disability issues. Governor Abbott appoints 12 committee members to the Texas Governor's Committee on People with Disabilities. And as we've all heard the saying, nothing about us without us, at least 7 of those members must be Texans with disabilities. We also have 6 ex officio members from 6 different state agencies that primarily serve Texans with disabilities, including the Texas Education Agency, Health and Human Services Commission, the State Independent Living Council, the Department of Family and Protective Services, and TDLR. In addition to that, Just briefly, our mission is to further opportunities for Texans with disabilities to lead full and independent lives of productivity and self-determination. And wanted to also share that the way that we monitor legislation is by developing policy recommendations in partnership with disability stakeholder organizations. We hold quarterly meetings throughout the state of Texas. Of course, during 2020 with COVID-19, our meetings had to go online. And in listening to stakeholders who bring their policy recommendations to us, the committee is able to vote on those recommendations and include those in a biennial report. We have a link to our biennial report in this presentation. You'll see the biennial report, which contains 66 recommendations in 10 policy issue areas. And then also from time to time, we issue special reports, and you'll see a link to our SSP Co-Navigator report, which makes recommendations to provide support services to deafblind Texans. A lot of the policy recommendations and legislation covered by the Texas Council on Developmental Disabilities also appears in our biennial report and are the same bills that we were tracking. However, there's going to be a few other bills that Monica and I will discuss at the end of the presentation. So with that, Scott, I will turn it back to you.
Excellent. Thank you very much, Ron. Now let's move to our recap. So we have a group of analysts from TCDD and the GCPD today, and I'm going to recognize them one at a time where they'll each run through a different issue areas that they were tracking during the session. But I'll start with a few words about the Texas budget. So we'll hear a little bit more about that throughout the rest of the program, but I did want to mention a couple of highlights. So let me... Okay, so the Texas state budget, SB1. Total expenditures, all funds of the Texas state budget for the next biennium is $248.6 billion. This is about $13.6 billion less than the current budget. And that difference is due largely to entirely to the inclusion of fewer federal dollars. However, lawmakers are or were expected to return in a special session this fall to appropriate federal COVID relief dollars, which should boost that total. We went into the session expecting there to be lots of budget cuts based on the pandemic and reduced receipts from that, but it didn't turn out that way. So budget-wise, we are doing fairly well. Within the budget, SB1 provides funding for an additional 1,549 waiver slots over the biennium. By program, that's 381 additional slots for class, 542 for HCS, 107 extra slots for Star Plus, 6 for DBMD, 42 additional slots for the MDCP, and 471 for Texas Home Living. So I just do want to note that HHSC's original request was for over 3,500 additional slots. So this is less than the agency had requested at the beginning of the session. With regard to community attendance, something that we at TCDD watch out for, as do other advocacy groups. SB1 does not include an increase in the rate for community attendance. So this leaves the current rate at, or leaves it at the current rate, which is $8.11 per hour. That's the base rate. However, there is a hope, it may be a long hope, but it is one, that some of those COVID relief dollars that I mentioned before could be used to increase the rate when we go into a special session. That is something that had been discussed during the regular session, and there was an amendment that was floated around to do that, but it didn't make it into the final bill. So we shall see. All right, so with that, I will move on to the rest of the experts, starting with Linda Logan. And let me give a quick introduction of Linda. Linda is a senior public policy analyst with TCDD and has worked in Texas state government since 1982. She has a master's degree in public affairs from the LBJ School. And before coming to Texas, she worked in public information at the National Institutes of Health. She has studied ethics and health services delivery at Harvard and was in the first graduating class of the World Health Organization's Mental Health Law and Policy International Diploma Program, which was held in Pune, India. Take it away, Linda.
Thanks, Scott. Thanks very much. We're going to start out with healthcare. Health and safety is a public policy priority for TCDD to ensure that Texans with disabilities have equal access and are proactively included in using community resources designed to maintain and improve health and safety. We're going to discuss 3 bills that support this priority and that pass this session. First, House Bill 119 by Representative Brooks Landgraf bans organ transplantation discrimination against people with disabilities. It was sponsored in the Senate by Senator Judith Saffarini. Although organ transplant discrimination is illegal under the Americans with Disabilities Act, you can see from the statistics on the slide that we still have a long way to go in informing how we approach making organ transplantation available, even to children who have disabilities. There's been a national push to ban organ transplant discrimination, with similar legislation being introduced in at least 8 states and at the federal level. However, research from the National Council on Disability found that discrimination continues to occur even in the 9 states that have enacted laws explicitly prohibiting discrimination. Discrimination is based on the misconception that people with disabilities are unable to handle the organ transplant treatment. There are currently around 100,000 people on organ donation lists nationwide with a 3 to 5 year wait time. This is a highly competitive setting. And in that setting, those with disabilities often find themselves apparently valued lower than those without disabilities. The NCD report correctly points out that if a person with a disability receives adequate support, the person's disability should have very limited impact on the ability to adhere to a post-transplant care regimen, which is one of the things that people that want to deny organ transplantation to people with disabilities bring up, is that the post-transplant time is sensitive. The crux of the issue is that the decision should not rest on someone else's assessment of a person's quality of life, but should be focused on whether organ transplantation is medically feasible and needed. Consideration of the person's quality of life is not a medical question and should not be a consideration in ruling a person ineligible for transplantation. The Texas Hospital Association was instrumental in the creation of this bill, which initially put great emphasis, and I would say greatest emphasis, on the protection of transplantation centers, hospitals, and physicians. There were negotiations with Disability Rights Texas and TCDD under the leadership of Alvaro Diaz and Senator Zaffarini's office, and changes were made to put greater emphasis on the rights of the patient. One thing that was not included in the bill is a fast-track procedure for challenging discrimination. This addition would help ensure that people in urgent need of an organ transplant can obtain timely resolution to their discrimination claims. The second bill that we can chalk up as a success actually a big win, was House Bill 797 by Representative Donna Howard, which allows home health nurses to administer any FDA-approved vaccine. Makes sense, doesn't it? Upon its signing, the bill went into effect immediately, and it was sponsored in the Senate by Don Buckingham. Many of the state's most elderly and vulnerable Texans, including individuals with intellectual and developmental disabilities, receive their health care almost exclusively at home through their home health care or hospice nurses. This has really been crucial to ensuring their health and safety during COVID-19. However, prior to the passage of House Bill 797, home health nurses were allowed to administer only 3 vaccines. And you see on the slide, it's hepatitis B, flu, and pneumonia, and nothing else. Thanks to House Bill 797, this statutory barrier was removed so that now medically vulnerable Texans and their family members and healthcare workers can safely get any FDA vaccination, FDA-approved vaccination at home. The third win for healthcare in Texas is House Bill 1535 by Representative Stephanie Click, which expands the eligibility for medical use of low THC cannabis. It was sponsored in the Senate by Senator Charles Schwertner. It is worth noting that the final version of the bill was less expansive than what was introduced, but it's still an improvement. This bill made changes to the Texas Compassionate Use Program. The shorthand for that, it's called TCUP, which was established in 2015 by Representative Click and others. And I might note that a member of our council was very instrumental in helping get that to happen. At inception, the program allowed only certain physicians, not any physician, upon the concurrence of a second physician, to prescribe low THC cannabis to individuals and only for intractable epilepsy. And you can see the progression on your slide that from 215 to 219 to 221, there's been a gradual expansion of all of the conditions for which low THC cannabis can be used. The physician requirement was also subsequently reduced from 2 to 1. And in 2021, the bill changed the definition of low THC cannabis from one where the allowable weight of THC was 0.5% to 1% of the cannabis product. Another TCDD priority is to increase protections for personal and civil rights of Texans with disabilities. In this regard, we put emphasis on strengthening person-centered approaches to guardianship, including self-directed first policies and alternatives guardianship. This session, at least 10 guardianship bills were introduced and passed. And here's a list of them on the screen. We're not going to review these. Most of them dealt with procedural aspects of guardianship that are more administrative than rights-oriented. So we're not going to be discussing them today. Actually, what we're going to discuss is a bill that didn't pass. Today, we're going to touch on House Bill 1675 by Representative Allison, because it resulted in the widespread successful advocacy in Texas in support of the direction the state has been moving for the previous 4 legislative sessions. This bill represented a change in direction that was not consistent with where we had been heading. The direction we've been heading in has been to uphold individual rights of persons for whom guardianships are sought, and to create a statewide system of oversight that functions by agreed upon rules to reduce abuse of guardianship relationships. Senate Bill 1675 would have created a separate set of rules and less oversight for guardianships undertaken by parents of minor children. As children with disabilities in public schools approach the age 18, their parents are often erroneously counseled to seek guardianship, even though under current law, they should be made aware of alternatives to guardianship like supportive decision-making. As proposed, the bill would have removed a number of requirements that are in place for every other proposed guardianship in Texas. And you'll see a list. That includes the appointment of an attorney ad litem to represent the proposed ward's interests, the use of a court investigator to look into the circumstances that are being alleged that require a guardianship hearing, an annual report to the court by the guardian, and an annual review by the court of the need to continue guardianship. In fact, in this respect, the bill would have allowed a court to review the need for guardianship not more than once every 5 years. And I'm sure certainly parents know, but everybody kind of knows that at age 18 or approaching age 18, a person isn't close to reaching maturity. And that's physiologically as well as psychologically. Further, the bill would have required the court to seal all the related records. The guardianship itself would have relied on any physician or psychologist in Texas to simply affirm that the proposed ward has a profound intellectual disability. And that was without accompanying standards or training or background on the part of the physician or psychologist. Many advocates were happy that the bill did not pass, but there is always the possibility that this bill or the idea behind this bill is going to return. In the meantime, something needs to be instituted to help people, including school personnel, understand that alternatives to guardianship, such as supported decision-making, may serve the interests of both parents and students better. Okay, I'm going to mention just a couple of other bills in the area of criminal justice. Children with intellectual and developmental disabilities end up in the juvenile justice system at nearly 3 times the rate of children without IDD. Additionally, there are concerns that children with intellectual disabilities do not have certain options available to them that children with mental illness have had under the Juvenile Justice Code. So House Bill 2107 addressed that issue by helping ensure that children who are unfit to proceed in juvenile court proceedings as a result of intellectual disability receive appropriate services and treatment, including outpatient services as necessary. That was a big win. That's great news. And in closing my segment, I'll say House Bill 2831 by White created an advisory committee to provide advice concerning persons with IDD confined in county jails, and there are far too many. In response to advocacy comment, the committee itself was enlarged to actually include a person with lived experience or a family member, and we feel like that was a step in the right direction. Thanks so much.
Thank you very much, Linda.
Thank you.
All right, so now one thing that I forgot to mention at the top of the program is that we will actually be going until 11:30 today. I know there was some initial promotion that said that we were going to be ending at 11. So we are going to 11:30. I'm sorry for anybody who got that early promotion and got the time wrong, and I hope it's not a problem. But again, if you have to leave, this video will be made available at some point next week so that you can catch the rest if you're unable to stay for the entire time. With that, we'll move on to our next policy analyst, and that is going to be Lauren Gerken. Lauren is a public policy analyst for TCDD. She has about 5 years experience in public policy and about 22 years experience as a self-advocate. She has a master's degree in disability studies and is currently studying her PhD in adult, professional, and community education at Texas State University, where she is focusing on community inclusion and development of people with disabilities. Her greatest passion is supporting advocates and speaking out for themselves in the best way they can. So, Thank you, Lauren, and take it away.
Good morning, everybody. I will be going over ECI, employment, and voting. I'm going to try and divvy everything up equally, but some things have more meat than others to really dig into. So for ECI, we had a couple of wins, but a couple of losses as well, that we will continue to work on. But HB 843 or HB 908, they were a same bill filed by my two different folks, Representative Lopez and Representative Johnson. Would have addressed a concern about having ECI and a private health insurance benefit. So currently, I didn't set up ECI insurance are not adequately covered by private insurance companies. They are covered better under state Medicaid insurances, and because of that, there's potential funding streamlining that isn't being accessed. So the private insurance bill was introduced as a benefit to families who have, private health insurance like Blue Cross Blue Shield, for example, and it was also introduced as a benefit to the state to help maximize funding, which since it is requirements for in conjunction with Rider 98, which was passed last session, that is trying to get the state to really maximize and streamline its funding in Texas. So HB 843 would have included a whole bunch of ECI benefits in private insurance that aren't currently in there, like therapies, speech therapy, occupational therapy, case management, or there's the unsung hero of ECI and things like case management and specialized skill training, which really prepared parents for how to navigate the system with their child and how to support their child at home. It would increase the annual limit of the cost in private insurance to $9,000 for each child, but any other cost limit would be prohibited under that bill. So there would be no cost limit for any other of the ECI services that folks access in ECI. Again, unfortunately, that bill did not pass. However, we are continuing to have conversations and work on it. Yeah, one of the other benefits that I would have had is the prior authorization, which anybody who's navigated insurance knows the joys of prior authorization. Those requirements for a health benefit plan would have been satisfied by insurance's inclusion in the individualized family services plan. And for the folks who don't know what an IADP is, that is the plan that really maps out what families need, what children need, and what kind of therapies you're going to navigate and things like that. And so instead of having to do all that additional paperwork to get prior authorization that were satisfied by the paperwork that essentially already exists. So we will continue to have conversations about that in the context of, you have families out there who have private insurance that cover most of their needs, and then they have a child with a disability and come to find out that their private insurance isn't going to provide the types of services that child needs to be successful, and it would also help funding at the state level, which we always need to work on. The next bill is actually a win, so it's HB 2658 by Frank, which actually addresses something specific in our TCDD ECI services policy provision, which wants to address continuing eligibility requirements. Without this law, people who are qualified for eligibility of Medicaid, particularly children, are only eligible for 6 months, and then at the end of 6 months, families get inundated with a bunch of paperwork that they had to fill out and get back in only 10 days. So it's a really tight turnaround where they had to verify their income and what kind of position that family is in, so that then state can determine whether or not that child is still eligible for Medicaid. And what's been happening is kids are dropping off of Medicaid and they're having to get back on because families face barriers and getting that paperwork back for a number of reasons, language barriers, busy schedules and things like that. So, HB 2658, you had to dig around in it a little bit. It starts on page 20 for anybody who wants to read the bill. Talks about extending continuing eligibility from one chunk to 2. So what that means is it's gonna go from you are eligible for 6 months, and then we will review your eligibility to you're eligible for 1 year, and then we will reanalyze your eligibility. And another really important piece to this bill is it expands the time in which families have to get that paperwork of eligibility back. So instead of 10 days, families are going to have 30 days to read that paperwork, figure that paperwork out, and get it back to the state. And the hope is that it's really going to cut down on gaps in Medicaid coverage and drop-off rates, where when a child drops off, the family that had to reapply for them and get them back on, or it can cause a gap in ECI delivered services, which when you're talking about a baby or a toddler, any gap in ECI services is going to be pretty significant. So we're hoping that this kind of keeps everything running smoothly for families, and it's also really going to help families that have more than one kid on Medicaid or using ECI services. So yeah, that is a win, and we will continue on working on other issues that come up, like the insurance. the other big piece of ECI is always the budget. The budget is definitely a hot topic item for ECI. But Scientists did well. And then Saturday, we came out with a budget of $339 million, which is really maintaining good funding level. We are hoping that funding can go into things like helping reach kids in rural areas, which has always been a gap, and trying to address the personnel turnover rates in the ECI world. They're pretty high turnover rates, and we're trying to address personnel retention. So we're hoping that kind of works together. Unfortunately, the funding end section isn't going towards the ECI Climate Action Plan, which was required by the federal level, but we do expect that things that are happening from the Climate Action Plan from the federal level and the state are going to be easier to maintain with the budget that we've gotten. So the next, that's what we have in the ECI world. The next area that I'm going to talk about is employment. So employment was a pretty quiet topic for bills and session, but we do have SB 50 by Senator Zaffirini. SB 50 was actually refiled from last session with Senator Zaffirini's bill SB 1818, and the bill is going to address competitive integrated employment initiatives in waiver programs for certain waiver recipients. So what this is really going to do is when folks enter a waiver, they get paperwork that asks about, okay, what do you want in your waiver? What kind of services that you want? And employment and services are a part of that. You have employment assistance and supported employment. And these services are meant to help people get a job and keep a job with things like job coaching and on-the-job support. But there are a lot of people who get asked the question, do you want employment and support? And they say, no, you can't. There's a simple yes or no question. And they say no because they spent their entire lives being told, you're not going to work, you can't work, you're too disabled, on that. So this is going to, SB 50 is going to help implement a more holistic approach to getting people employment and services. Really look at the person's interests and goals and kind of digging around deeper than a yes or no question. And then in addition to some accountability and monitoring of what is being done so that we can really look at, okay, who is saying yes now into employment and services with those action steps, but also maybe what are people still saying no and they're being onboarded. So this bill is really a step in the right direction for Texas employment boards policy, when states employment has to be the first and preferred option for people with disabilities in Texas, and it's gonna help support folks who maybe want to work but just don't know they can yet, or haven't been given that option before. That intention we will build off of this, hopefully, when things that address income limits, where maybe a labor to uses all the insurances and then ends up working and earns $10 over the income limit for that month, and then it gets paid off their labor. So we're gonna try and address that issue, because that came up quite a bit from the community when working on this bill. Okay, so the next one is DC. I'm sure most of you know what's happening in DC when the Texas Democrats were in DC trying to address voting concerns. But during the regular session, we had HB 7 and HB 6. The HB 7 was very huge, and it had some pretty significant restrictions on voting access and election administration. Things that some things were taken out, but the issues that came out were, issues with cumside voting and getting driven in the poll. Some versions stated that if you drove someone into the polls and they had a disability and wanted to use cumside voting, that the driver would have to verify their disability. That there were requirements in there briefly about proving disability. So somebody who wanted to use services had to provide proof either with Social Security Administration information or a doctor's note, which the community as a whole pointed out. If I have to go to the doctor and get a note and say I'm disabled, that I'm gonna have to pay to go to the doctor, and we all know you can't go to the doctor for anything for free, and that is a poll tax, which is not permitted. So that was taken out eventually. However, even though HB 7 and HB 6 did not pass, it has come up again during the special session, and many of the concerns from HB 7 and HB 6 are still in there. We are still trying to address signature carry, and so for those who don't know, a mail-in ballot can be denied based on signature inconsistencies, which people in the disability community have pointed out. My signature is always inconsistent. I can't produce a inconsistent signature, so my ballot is most likely going to be denied. Trying to figure out better carrying functions for verifying identity or introducing more accessible ways to sign a mail-in ballot, like signature stamps. The other concerns in that include there's an oath that people who exist from disabilities have to take that violate federal voting laws. So, even though it's the session recap, but the regular session, the voting bill is an ongoing topic that we're facing. So I know that was a lot. Obviously, you will get a contact info like that. So if you have any further questions, always reach out to me. I'm happy to work with you. Thank you.
All right, thank you very much, Lauren. And now we move to Sabrina Gonzalez. Sabrina is a public policy analyst at the Texas Council for Developmental Disabilities, and her policy portfolio includes an emphasis in special education, criminal justice, and housing. She is originally from the Rio Grande Valley and has a younger sibling with an intellectual disability, which is what first prompted her to begin her journey into advocacy. Thank you for presenting, Sabrina.
Thank you, Scott. And the first few things that we're going to be going over today are issues related to accessibility and bills that we saw this session in relation to accessibility. And this session, TCDD adopted a public policy priority related to accessibility, which involved raising accessibility standards in Texas to promote community inclusion and ensure equal access. So the following bills are going to fall under this category. The first bill that we're going to be discussing is Senate Bill 776, filed by Senator Lucey Jr. This is the Adaptive Sports Program Bill through UIL, or the University Interscholastic League. Try and say that 3 times fast. But what this bill does is it charges the UIL to create an inclusive sports program for students with intellectual disabilities, similar to Special Olympics. The idea of this bill is to expand extracurricular opportunities for students with intellectual disabilities. It was signed by the governor and will take effect later on this year. The next bill we're going to be discussing is House Bill 24 by Representative Dominguez, related to inclusive and accessible playgrounds. As we know, there are thousands of bills that are filed every session, and unfortunately not all of them make it through the process. And this was one of those bills that didn't make it through the process, but is still important to accessibility standards in Texas. This bill, if passed, would have appropriated funds to school districts to ensure that each school district has at least one inclusive playground accessible to students with disabilities. The idea of this is that each school district has an area where students with and without disabilities have the opportunity to play, learn, and have fun together. But unfortunately, this bill died on the state calendar, and we will see where it goes in the coming sessions. Moving forward, the next bill we're going to be discussing is House Bill 168, filed by Representative Gonzalez, the Inclusive Daycare Bill. This bill also did not make it through the process, but what it would have done would have been prohibit childcare facilities from discriminating against children and families on the basis of disability. Currently, that is not in state statute. Discrimination on the basis of disability is fair game, apparently. And this bill included language that would have increased annual training requirements to providers to ensure that all providers have information related to disability and are able to serve children with disability in their facilities. This bill was left pending in committee and did not make it through the process, unfortunately. And the last bill in relation to accessibility that we're going to be discussing is House Bill 2309, filed by Representative Dominguez. What this bill would have done is that it would have increased fines associated with illegally parking in accessible parking spots from $750 to $1,000. As many of you on this call know, accessible parking spots are extremely important for folks with intellectual and mobility disabilities to ensure that they can access their community and actively participate in our communities. And so it's really important that these are not taken by folks that don't need them and don't have a need to take this space. And in addition to increasing these fines, this bill would have created an educational course on accessible parking for the dismissal of a charge if you were charged with illegally parking in an accessible parking spot. This bill passed in the House, but stalled to get a hearing in the Senate and ultimately did not make it through the process. Next slide, please. The next topic that we're going to be discussing are bills associated with special education. Special education was also one of our public policy priorities at TCDD, and our council found it really important to ensure that students with disabilities receive the necessary services to promote healthy growth and development, to support long-term success and independence. And the first bill that we're going to be discussing in relation to this is Senate Bill 89, filed by Senator Menendez. What this bill does is require school districts to create an IEP supplement for COVID-19 for students that receive special education services during the 1920 and 2021 school years. As we know, COVID-19 and the disruption that it caused really hurt lots of students and educators in trying to ensure that all students received an appropriate education and that their needs were met and that services were continued. And so this bill is in direct response to the pandemic and ensuring that all students, if they experienced a disruption or delay in services, that they receive the support that they need. And so in this IEP supplement, the IEP team, or the ARD team, as some of you know it as, are meant to really assess how the student fared throughout the pandemic. And if there was an evaluation that was due, that evaluation is received, to make sure that the IEP plan was followed during this disruption of services. And if there was a disruption or regression in services, if compensatory services are necessary and to what extent. And that's what SB 89 will do. And furthermore, in speaking about bills directly related to COVID, we have House Bill 2125 filed by Representative Mary Gonzalez. This bill did not make it through the process, but is related to COVID-19. And what it would have done is that it would have extended special education eligibility for students that received special education services during the 1920, 2021, and 21-22 school years. Under the Individuals with Disabilities Education Act, or IDEA, students age out of receiving special education services at 21. But as we know, there are many students that received special education services that aged out during the pandemic and during this disruption in services. So what this bill would have done would have allowed students to remain eligible for one extra academic year to make up for learning loss during the COVID-19 pandemic. This bill did not make it through the process, but Representative Gonzalez and her office refiled this bill during the special session as HB 186. And this special session, as we'll get into in a little bit, is pretty intense. And so we're going to be discussing a little bit about that later. But the governor did have a list of agenda items that he would like legislators to cover. And unfortunately, temporarily extending special education eligibility for students 21 and plus impacted by COVID-19 school closures is not on that list. So we appreciate the office for taking notice of this important issue and filing it anyways. The next bill we're going to be covering is Senate Bill 1716, filed by Senator Taylor. And this is in relation to the establishment of the Supplemental Special Education Services Grant Program. As some of you may know, in January of 2021, TEA launched the Supplemental Special Education Services Program. And this was launched specifically to provide Texas public school students and their families with $1,500 stipends to pay for services, curriculum, and other supplementary educational needs from a pre-approved list. And what this bill does is makes this program permanent with a few changes. This program that is through SB 1716 will require the coordination of families with the annual review and dismissal committee to ensure that families and the IEP team are able to collaborate and really see what would benefit that student. And this bill is effective immediately, so we can see that TEA will hopefully be establishing this program later this year. Next slide, please. Thank you. The next bill we're going to be covering is House Bill 159 by Representative Gonzalez. This bill is related to teacher training and staff development. And what it does is that it adds requirements to educator prep programs so that all teachers are better equipped to serve students with disabilities and learners with disabilities in their classrooms. As we know, students with disabilities find themselves in all educational settings, in general education settings, gifted and talented settings, advanced placement settings, and we really want to make sure, especially with the advancement of inclusive teaching practices, that all teachers are prepared to serve students with disabilities and not just those that are in special education classrooms. And so this bill added requirements for teachers to have a basic knowledge of their requirements under IDEA, the Individuals with Disabilities Education Act, and Section 504, in addition to learning strategies about how to support learners with disabilities in their classrooms. And this will be effective later on this year on September 1st. The next bill that we'll be discussing is HB 2256 by Representative Guerra. This is related to the establishment of a bilingual special education certification. This tasks the Texas State Board of Educator Certification to create a bilingual special education teacher certificate. This is specifically to meet the needs of English language learners, students with disabilities. This population specifically, there are best practices to support this population, and this certification is to ensure that more students in the state are able to support learners in this predicament. And so we're excited to see that this program will be established and that more teachers will be able to meet the needs of students that are both English language learners and have disabilities. Moving forward, we'll be discussing House Bill 785 filed by Representative Allen. And this bill is all about behavioral intervention plans and their management. What this bill does is that it specifies that and requires that an annual review of behavioral intervention plans are had during the ARD meeting. This should already be happening, as behavioral intervention plans are meant to ensure that they are working for students. This is a static document that can be and should be revisited at least on a yearly basis. And so HB 785 makes sure that this is happening and specifies it in code. In addition to that, this bill includes language that requires school districts to notify parents if their child with a disability was restrained or received another sort of disciplinary action at school. This already exists in administrative code, but what HB 785 does is include it in the education code and strengthens these requirements, and has a few other mentions of refinement on this process. And that's just a high level summary of what this bill does. But moving forward, the last bill that we'll be discussing in relation to special education is SB1, as we've heard a little bit about what SB1 does and how much money was appropriated this biennium. But SB1 appropriates funding to all state government and is the budget. And in this budget, we wanted to highlight that funds were appropriated, specifically carved out for students with disabilities. Some of this was specifically to appropriated to school districts to ensure that they have funds to cover captioning of instruction materials. This is already required to be provided under the Americans with Disability Act, but this provides funding so that school districts can carry out this obligation. In addition to this, there was also funds appropriated for students with dyslexia and students with autism specifically, and we should expect that school districts will have this money at their disposal to support students with disabilities. And from there, I will pass it off to our colleagues at the Governor's Committee on People with Disabilities.
Thank you, Sabrina. And next up, we have Monica Villarreal, who is a research specialist for the GCPD and has been in this position for a year and a half, but she's been working in the field for over 5 years. So thank you, Monica.
Thank you so much. I'm actually gonna have Ron talk about the emergency management portion. I just want to mention that a lot of what you all already covered were also part of our policy recommendations and priorities for our committee. So we're just speaking on the items that were not covered by TCDD, and Ron will talk about emergency management.
All right, thank you, Monica. There were several bills filed during the session related to emergency management, but the one that I want to mention is Senate Bill 968. Originally, it was filed as House Bill 3711 by Representative Busey. Late in the session, that bill was amended to Senate Bill 968. And what it does is it requires well checks for individuals who are considered medically fragile or fall into one of several categories. These well checks are to be conducted by the local Office of Emergency Management and are intended for people that are signed up for the State of Texas Emergency Assistance Registry, or STEER. Texans with disabilities can sign up for STEER by calling 211 or going to the STEER webpage. In the past, STEER has not been a guarantee of any specific emergency service during a disaster, but was primarily used for planning purposes only. So with the implementation of this bill during a disaster, for those individuals on the STEER registry that fall into those specific categories, the local Office of Emergency Management will have to conduct well checks, which could include being done by members of the Texas Military Department or CERT team members or whoever is trained and vetted by the local Office of Emergency Management. All right, I'm gonna turn it back to Monica to cover the other bills in our section of the presentation.
Thanks. Additionally to that, we also cover veterans issues. And there was a bill filed by Senator Campbell, Senate Bill 792. This specific priority was not part of our current biennial report, but has been present in our biennial report in previous sessions. And so we were very happy to see the bill pass. Actually, a member of our committee in his capacity was serving with the Paralyzed Veterans of America, was instrumental in getting this bill passed. This is a bill that veterans have come to us, explaining to us that they want this to be in effect. And so what this bill does is that for disabled veterans who have DV license plates, now they will, if they want to park in accessible parking spaces at businesses or different places that they go to, they will also have to have the accessible parking placard and go through the same process as other individuals that have this placard. It basically allows for disabled veterans with mobility disabilities to park on in those parking spaces, but people that may have the veteran license plates but don't have mobility disabilities, they are unable to park there now, starting on September 1st, sorry. And talking to the DMV, who is the agency that administers this program, they said that they were going to issue rules as to how this process will be implemented, since it's a big change for the way that they process these placards for disabled veterans. So I feel like we will learn more about how this program will look like as the rules are implemented. Now I'm going to talk about missed opportunities, or things that we're working towards and we're looking forward to, but unfortunately did not see come to arrive at the finish line. First and foremost, House Bill 3287 by Representative Sabrina Gonzales. This bill would have been essential and vital for the deafblind population of Texas. This bill would have created and established a program within the Health and Human Services Commission for co-navigators or support service providers who are essential for deafblind individuals in Texas to be able to live independent lives. This is something that the deafblind community has been pushing for since the 85th session. And so to quote Ron, we are raging incrementalists. And so every session we've gone in a little bit further and a little bit further. And so hopefully this bill will continue to be filed, and we can in the future, near future, see a success in this area. Sabrina Gonzalez filed this bill again during the special session as HB 97. So we really appreciate her team and her office continuing to draw attention to this very important issue. The other bill that was part of our legislative priorities that unfortunately didn't make it through the finish line was House Bill 290 by Representative Cortez, which I think Lauren mentioned earlier in this presentation, but would eliminate 6-month checks for children in Medicaid and would basically align the program for their eligibility checks to match those of the Children's Health Insurance Program, CHIP. And that way, children will not drop off as they currently do from the rules. Next, I think Ron is going to talk about more of what we think should be worked on in the future. I know Ron talks about we're never too late for the current session, we're just early for the next session. So we can talk about things that we would like to see in the future as well.
Yeah,
Ron?
Thank you, Monica. So as mentioned at the beginning of this presentation, we have a biennial report that contains a wish list of policy priorities by advocates. And one of those brought to us in January of 2019 was adult changing tables by a advocacy group called Changing Places. And the good news is the International Code Council has recently adopted standards for adult changing tables in places of public accommodation like airports and recreational venues like ballparks, stadiums, that sort of thing. And so we've taken one step closer to realizing this for the many families that have a family member that requires personal care assistance and needs an adult changing table to be able to change in a public place and enjoy all the benefits of living in the community. Another one that we've been working on for a couple of sessions now is restoring lost funding for deafness resource specialists. The Health and Human Services Commission's Office of Deaf and Hard of Hearing has contractors that provide vital services to deaf Texans. And these deafness resource specialists serve or used to serve the entire state. Right now, 33% of the state is missing a deaf resource specialist that can provide advocacy support and resource support for deaf Texans. And so we're hoping that in the next regular session, HHSC can include in their legislative appropriations request additional funding to restore the resource specialist positions that were lost when we reorganized Health and Human Services and transferred functions from the Department of Assistive and Rehabilitative Services to both TWC and HHSC. We had a couple more emergency management priorities. One came out of advocacy work during Hurricane Harvey to support people on the autism spectrum or who have an intellectual or developmental disability. As you can imagine, in any disaster, supporting individuals with IDD and with behavioral health challenges can be very stressful, but having some of those same individuals put in a mass shelter situation in Houston, Texas, with 10,000 of their closest neighbors can be particularly stressful. So we're recommending to develop a behavioral health task force to support people with IDD and behavioral health disabilities to make sure that they can assist the shelter manager in managing shelter placements and addressing complex behaviors, establishing blue rooms for people who have challenges with being overstimulated in a shelter scenario, and perhaps even identifying shelter alternatives like hotel or motel rooms. We also had recommendations in our biennial report that did not get a bill filed related to behavioral health specialists to be deployed in those disaster shelters, and also to increase the availability of high quality, comprehensive behavioral health services to individuals with IDD. And then finally, before the session, we worked with advocates on a transportation network committee collection of recommendations. And we know House Bill 100 from the 85th session changed the regulation of transportation network companies like Uber and Lyft from municipalities to the state. And at the end of this last biennium, data needed to be turned in by those TNCs or transportation network companies on pilot programs for providing TNC services to people with disabilities that use a fixed frame wheelchair. No bill was filed during this session to address the accessibility of TNC services for people that use fixed frame wheelchairs. And we encourage the legislature to take up a study in the interim between now and the next session to look at what can be done to ensure that all Texans, including Texans with disabilities that use fixed frame wheelchairs, have access to be able to take a TNC ride from the airport or anywhere in their community. So that wraps up our list of what we refer to as missed opportunities. So I'm going to turn it back to you, Scott.
Thank you very much, Ron and Monica. So now we are going to move to Demi Tomasides. So Demi is the public policy intern at TCDD and a rising senior at Southwestern University. Her dream is to open a theater company in underprivileged communities for children with special needs. And since joining TCDD in January, she has found a niche to bring her studies and her passions together. So Thank you, Demi. And she is going to be talking about some of our TCDD bills of the week.
Thank you so much, Scott. I appreciate the intro. So yeah, today I'm going to be talking a bit about our bills of the week. And this is a regular feature that we publish throughout session, gives us a deep dive into a piece of disability-related legislation. On the slide, I've included 4 numbers to help recap our results. First off, we published 18 bills of the week this session. Each one highlighted a summary of the bill, the author, joint authors, any background information, where it is in the process, the fiscal note, who supports, opposes, and a quote from the bill author themselves, just the whole 9 yards. And the cool thing is that a lot of the times, the bills of the week serve not only as a way to keep the disability community up to date, but also as a tool to advance legislation. At one point, HB 2107 was stuck in committee. We reached out to a staffer in Rep. Wu's office, and they told us who we should contact. We got in touch and made sure to share this particular bill of the week in order to highlight the importance of the legislation. Now, all I'm going to say is that a mere 3 days later, HB 2107 moved on in the process, and it is now signed into law, which is pretty cool. In fact, this brings me to our second number, 11. Because 11 of our 18 bills of the week have now been signed by Governor Abbott. As we continued to track each feature through session, we made sure to update the public through a variety of mediums, including blog posts, e-blasts, and my personal favorite, Instagram Reels. Now, an Instagram Reel is basically like a TikTok, so you can ask your teenager about that. And then if you don't have a teenager, of course, really short video. Perfect, dare I say, for highlighting the important pieces of a featured bill. As for our reach, between e-blasts and social media posts, the bills of the week totaled almost 100,000 reaches. That is 100,000 times that our content was made available as a resource to learn more about the Texas Leg. So as I conclude this bill of the week recap with my final and favorite number, 316. Head over to our Instagram page and watch our March 16th reel starring our very own Scott Daigle. He condensed hefty information about in-person visitation into a short, digestible scene that clearly conveyed the intentions of the bill for anyone to enjoy and appreciate. So yeah, thank you so much. That was just our quick bill of the week recap. And with that, I will send it back on over to Scott.
Thank you very much, Demi, and thanks for the plug. So we were really proud of the Bill of the Week feature this session, the legislative news e-blast that we would send out each week, all of the informational efforts that TCDD was using to get information out to the public, to advocates, stakeholders, and the general public. So if we'll talk about, or I'll show you how to subscribe to those later on in the presentation. So we are, we're running low on time. I'm going to quickly run through, talk about the special session. But if you have any questions, please start putting them into the Q&A, and we will try and answer a few of them before the end of the program. So special session update. As we've kind of discussed, or as has previously been discussed by some of the other speakers, the legislature is currently in a special session, but where that special session is going to lead, we don't really know at this point, because more than a third of the body has retreated to Washington, D.C. to try and kill some voting legislation, which is very similar to what Lauren was discussing earlier today. So officially, there is still, the current special session is supposed to last until August 6th, but we don't really know if lawmakers will be able to meet until that time. The Senate is currently meeting and passing legislation, but the House does not have a quorum to meet and consider bills. So we'll see. I did just want to throw up the governor's special session call includes the following, includes 11 items, which you all see up on your screens here. Over the weekend, this past weekend, there were a variety of hearings on some of these bills, really getting pushed through quickly. And I can tell you that TCDD did offer in-person and written testimony on 2 of the bills, or rather 2 of the items. We provided our testimony in both the House and the Senate, and that was on bail reform and the elections bills. So I can tell you that the elections hearings both went very long in the House and Senate. The witness registration started at like 7 o'clock in the morning on Saturday morning, and then people did not start to be able to provide testimony on that bill until well after midnight. It was a crazy, crazy night that went until about 7 in the morning. So we'll see what happens with the special session. If the governor has announced that if lawmakers don't come back in time to consider things by the end of this special session, he will call another special session immediately after this one, which is well within his right as governor. The governor can call as many special sessions as he wants. They can last no longer than 30 days, though the legislature can choose to end them well before that 30 days if they so choose. So that's a special session. I will mention again the TCDD resources that you can find on our website. So if you go to our website, you can find information on COVID-19. You can find a page on the Texas legislative session with all of our informational resources. You can also find one-pagers that we put together, informational flyers that can be distributed, such as we have a one-pager on people first language. We've got another one on ableism. So those are all great resources you can find on the TCDD website, and I encourage you to check that out. I mentioned that you can subscribe for our news alerts at this address on the TCDD website. So go and you can subscribe to information about grants that we are putting out RFAs for. You can subscribe to our Texas Legislative News newsletters. You can subscribe to information about our Partners in Policymaking program or other leadership and advocacy opportunities, things like that. So check it out if you're interested in receiving a few emails from us. And I will also share the contact information for the Governor's Committee on People with Disabilities, their website here, and they also put out a great number of good informational resources. So if you want to sign up for their newsletters as well, they're always very helpful. So there is their contact information. And I don't think I mentioned previously, but we will be sharing these slides once we send out the link for the video of this discussion as well. So you'll have all of this contact information on those slides. And now we move to the questions, and I will stop sharing my screen. And I'll turn on my video. And if the other panelists would also like to turn on their video. So we have about 10 minutes left for questions. So if anybody has one, please put it into the chat.
Hi, Scott. So we have one up already, and it is, what is the most important IDD mental health legislation passed this session?
So I'm going to check and see if Linda Logan is available. I know she had some stuff going on, so she may be able to answer that because she was kind of the person in our office that was tracking mental health legislation. If she is not available, and it looks like she may not be, unfortunately, this is a question that I'm going to have to follow up on just because I'm not as familiar with it. So I'm sure that we have Muna's information from the registration. So I will follow up with that question after this event, and I'll try and include that in the follow-up that we do to all of the attendees and registrants for the program. I apologize for not being able to answer that right on the fly. All right, do we have any other questions?
All right, so we do have another one, and it's from Melissa Bell, and she is saying that she learned for the first time today that some people with disabilities have faced discrimination when trying to get an organ transplant. Is there a certain population facing this discrimination, such as people with IDD, autism, mobility issues, or is it kind of just across the board?
So again, this is another question for Linda, honestly, but it's my understanding based on the research that I did on the bill that it is kind of across the board that people just consider generally people with disabilities as not being able to make it through the transplant process or the recovery process. As Linda mentioned in her presentation, there's not necessarily statistical data that shows that to be the case. It's just it's a misunderstanding. Demi, you also researched this issue a lot because it was one of our bills of the week. I don't know if you had anything else that you'd like to add on that.
No, so I think nail on the head on that one. It is across the board. There were a lot of personal stories that I read about people with Down syndrome being specifically discriminated against in this situation. So I think if there is a specific population, it's Down syndrome, but it is really across the board, unfortunately, on that.
Scott, yeah, to build on Demi's point, from what I have read and interpreted, the stories that are coming from Down syndrome, there's an association between the heart problems that people with Down syndrome can be more prone to, and the perceived inability to handle and recover a transplant procedure. So there is a medical reason behind it. However, there's no evidence that it's particularly accurate, but that is what some people claim, is that the people with Down syndrome are more prone to heart problems, and that impacts their ability to handle procedures.
Thanks, y'all.
Yes, and I dropped some information in the chat. This is Sabrina about Charlotte Woodward, who is a prominent self-advocate in this space. And her story, she's fighting at the federal level for Oregon discrimination ban on people with disabilities. And her story is really great. So I encourage all folks to read those articles in the chat about Charlotte and her story.
In fact, I think they're going to be naming the federal legislation after her. So the federal bill that does the same thing that was passed in Texas after Charlotte. Pretty cool.
Excellent. What is our next question here?
All right, so we have another one. This is from Maribel Farish, and she is asking if we can expand or provide any other information about how districts will inform parents about the stimulus that TEA and Governor Abbott issued specifically for COVID-19 that had some restrictions and parents could access it directly, but now it looks like it's going through the districts. Her concern is that parents don't know about this, or if we know anything about if there's going to be a section added to the IEP that directly talks about this question. So just kind of any details we could provide on that topic.
This is a great question. Thank you, Maribel, for bringing it up. The supplemental special education program that was launched earlier this year by TEA was directly in response to COVID-19 and the struggles that lots of parents and families of students with disabilities faced. And it's been a really work and effort for folks to spread the word about this opportunity and these stipends that are available to families. And the Texas Education Agency is the one in charge of putting this application process together. And I know that it's been a little bit of a struggle to try and get that information distributed to parents and families and the folks that are really going to benefit with these benefits. And so TEA has come out with a couple of resources to specifically assist families that are trying to navigate this process and see if their children are eligible and how they can go forth in using these funds. And as we spoke about a little bit a while ago on SB 1716 by Senator Taylor that will make this program permanent, we're going to see how the Texas Education Agency moves forward to make this program established. And so I mentioned that there are a couple of differences that happen with this program that TEA is going to make permanent, and that does include coordination with the annual review and dismissal committee. Currently with the SSCS program, families are at liberty that are eligible for the services are at liberty to use those funds on whatever services or supplementary materials that they believe would be helpful for their child. And this new permanent program would have coordination with the annual review and dismissal committee so that families, the student, and the IEP team can collaborate and see what would really be in the best interest of the student and their success in the future. So I hope that answered a few of those questions. And if there's any additional information, you can feel free to contact me after this presentation.
Thank you, Sabrina.
Yes, thank you. All right, so the next question is related to the emergency management bill, Senate Bill 968. And the civil penalty only applies for people considered medically fragile. Is there a specific definition that they're using for that?
So I'm actually trying to scan the bill really quickly to see, and I don't know if there is a specific definition in there. I see, so that's something I'm going to have to follow up on. I would assume that there is, or that it refers to another definition, but, oh, here we go, I see it. So it is defined as an individual who, during a time of disaster or emergency, would be particularly vulnerable because of a medical condition, including individuals with Alzheimer's disease or with Alzheimer's or other related disorders, receiving dialysis services, who are diagnosed with a debilitating chronic illness, dependent on oxygen treatment, and who have medical conditions that require 24-hour supervision from a skilled nurse. So that is the definition that is used in the bill. And that was a lengthy definition, so I can send that out with the follow-up materials as well.
So I will say that there's going to be a lot of rulemaking around this. Like the majority of that section of that bill talks about the Department of State Health Services and HHSC coming together to develop rules on how this will be implemented. So maybe will be also fleshed out more there.
Excellent. Thank you, Monica.
The civil penalty is part of the caption of the overall bill, but I don't think it applies to this section of the bill. So kind of got lumped in there. But it's also likely that implementation will happen at a local level. And the part that's unclear is not every county participates in the STEER program. Not all of them have a data custodian. So what we're waiting to hear from is, does this only apply to counties that participate in STEER and have a data custodian, or will it apply to all counties? And we'll be chasing that information and get out a Gov delivery with more information as soon as we have those answers.
Excellent. Thank you for all that information. So we are at the end of our time. I did just want to quickly respond to, there was a question in the chat about when our next update would be. It is unlikely we will be doing another update before the end of the special session, and then we'll kind of be watching the special session to see what happens and what there is to update on. But I will say that we are planning on doing our next Disability Policy Academy related to the topic of redistricting, which is supposed to happen in a special session at some point in the next few months, either in September or October. So we are planning on doing that on redistricting and about the census and the census data that we are getting from the federal government, which we should be receiving within the next month or so. So we'll be sending information out to all of that. Anybody who's registered for this academy should be getting that information at some point in the future. But in the meantime, if you have any questions, please don't hesitate to reach out to TCDD or to GCPD with any questions or information that you want to share or anything like that. And aside from that, thank you very much. Yes,
just one thing. We also host webinars once a month. If you're interested, sign up for those as well.
Excellent. And they are super informative. So thank you for giving that plug. All right. Well, with that, we will call it a day. Thank you, everyone, for joining us for this Capitol recap. And we look forward to discussing things with you in the future. All right. Thank you very much.